Mommy Brainers, welcome to another episode of Fully Informed. Today we're going to be talking about induction, and this is a really big topic, so I'm actually going to break it into 3 different parts. Today we're going to be talking about what is induction, what is the cascade of interventions that is often referred to when you talk about induction, what are some reasons to induce, and also a handy tool called the Bishop scale. What is induction? Induction is synthetically inspiring or encouraging labor. This is frequently done by Pitocin and other medical forms. There are also some non-medical ways that you can try to bring about labor, but today we're going to be talking about the effects of medical induction, which include Pitocin, cytotec, and other forms of medical induction. You may be wondering, why is induction always talked about as though it's something to avoid? Well, you may know some of these things already. You might know that induction contractions tend to be stronger. You might know that C-section rates are higher with mothers who are induced, and you might know that the intervention rate is higher. So today I want to talk about something called the cascade of interventions, and this is a chain reaction of what happens when you start with one intervention and what typically follows from there. So let's say you're getting induced. An automatic outcome of induction is decreased mobility because you are going to have to be monitored. It's important to be monitored when you're being induced because there are risks of more fetal distress when you're being induced synthetically. Because you're going to have decreased movement, you're likely to experience more pain. Most people do agree that laboring in bed is actually the least comfortable place to labor. Most women, when allowed to move about naturally, will move about. They'll walk, they'll rock, they'll lean over the edge of the bed, they'll sway, maybe use an exercise ball or a yoga ball. So sometimes being tethered to one place with monitors or IVs can be kind of discomfortable. So the pain of induction can be a little bit harder to tolerate, just based on the circumstances surrounding induction. This generally leads to an epidural. 78% of first-time moms will also have an epidural when they're induced, which leads to complete immobility in most cases. We will talk about epidurals in a further episode and the specific side effects related to that. But right now let's talk about a few of them, which of course is immobility, longer labor, and heightened chance of fever, more chance of fetal distress, etc., etc. This leads to a 31% C-section rate in women who are induced for the first time, their first baby. That means that the C-section rate after an induction is at least doubled. At least 2 times the chance of a C-section is kind of a scary thought. So who gets inductions? Why do we do inductions if the cascade of interventions tends to go that route? Well, there are some reasons to induce, and it's important to look at your specific situation and not just say that across the board inductions aren't a good choice, because that's not true. There are some cases in which the pros will outweigh the cons of having an induction, and it's really important to remember that no matter what decision you're making, really weigh it against your own situation. One beneficial reason to induce might be premature rupture of membranes. This is when your water breaks before labor has started, and this only happens in a very small percentage of women. And in 90% of the women where their water breaks before labor starts, they will go into labor within 48 hours on their own. It is up to you and your care provider to decide how long you're willing to wait for labor to start, but induction in these cases can sometimes be beneficial, especially if cervical checks are being performed regularly and the chance of infection increases. Another reason that might be beneficial to have an induction is if you go past the 41-week mark. Closer to 42 weeks would be when induction might be considered. Once again, I do suggest going to watch my due date video. This might help you get a better perspective of when it's safe after 40 weeks and when it's not safe after 40 weeks. And remember, it's always a case-by-case scenario. It's never across the board anything. Another reason that someone would be induced for a good cause would be preeclampsia or high blood pressure. These are some common reasons that are given for induction, but they're not supported by research, and most of the time these things are actually found to be more harmful than helpful. One really big reason people get induced is baby too big. And this is a common one because the fear is if you grow a baby that's big, it might be too big to fit through your birth canal. The fact of the matter is, most of the time your baby is going to fit. And I also made a video about this, so I'm going to link it up here, and you can go watch that if you'd like to. Another reason some people are given that isn't supported by enough evidence is intrauterine growth restriction before 37 weeks. So before 37 weeks, if your baby's measuring a bit small, sometimes it might be better to wait and see rather than induce before 37 weeks, because induction before 37 weeks is considered premature. There is lack of research on induction in regards to twins, gestational diabetes, full-term intrauterine growth restriction, and also low amniotic fluid. There's not enough research about these subjects to know whether induction is more helpful or more harmful, so it's really up to you and your care provider to decide what to do in those situations. One non-medical reason for induction would be your caregiver's preference. Your caregiver might have something coming up that they're busy, they might be out of town, they might be on a holiday, and those are situations where they might suggest induction for no medical reason. Other reasons that they might suggest induction is personal preference. They might prefer for you not to go past 41 weeks or even 40 weeks, and that would be their preference. So it's important to know who your caregiver is before you get to that point. Remember, if you have differing opinions, it's never too late to switch providers. The non-medical reason I want to talk about would be your preference. You might feel perhaps you've passed 40 weeks and you might feel that you're ready for an induction. And I always think that it is important that a woman is the artist of her birth. I believe that you have complete control over what you want. I believe you should be supported, and I believe you should have the facts. So here's a really handy tool to help you decide whether an elective induction is right for you. This tool is called the Bishop score, and a score of 5 or below is a poor chance of successful induction, and 8 and above is a very good chance of successful induction. You get points by how dilated you are, the length of your cervix, the consistency of your cervix, the position of your cervix, and the station of your baby's head. So if you're more dilated, more effaced, and your baby's head is low, you're more likely to have a successful induction than not. But on the flip side of this, it's important to note that if those things are true, you're probably going to have your baby soon anyway. So this is a really good tool to use both in deciding for yourself, but also to present to your care provider if they are suggesting an induction where you aren't feeling comfortable with an induction. So that's it for my episode on the basics of induction. We'll be talking about induction for 2 more episodes, so sit tight. Thanks for watching. Please subscribe, let me know if you have any questions or if you have anything else you want me to talk about. And that's it for today. Bye.